again everyone, it's Dr. Tim Newton with Inspire Movement Physical Therapy. In this video we're going to talk a little bit about our mechanical approach to dealing with hip pain. So first let's just talk about what everybody knows. Any physical therapist, any doctor out there could tell you about the common muscle imbalances that we see in this region. Tightness in the lumbar spine, tightness in the hip flexors and adductors, weakness in the glutes, and weakness in the abdominal muscles. It's a very common pattern that we see. It even has a name. It's called lower crossed syndrome, if you want to look that up. But instead of getting at exercises to give you for this, right, to stretch or strengthen, we want to first get to the root of the problem, right? Our approach thinks that we need to get at the root of this. A good example of what I'm talking about is that the glute weakness. Take that for instance. Very often, the glute won't be firing, it won't be contracting well. But once we loosen up a restriction in the sacroiliac joint or on that bottom segment of the spine, right, and I'm talking about very specific joints in there, it starts firing better without you having to do a single exercise. That's what we're talking about. We are concerned with the relationships of the body parts and when you get movement in one area, what it does in the other areas, right? Nothing in the body happens in isolation. Another good example is the hip flexor tightness in front, right? Typically, that is related to restrictions in the upper lumbar spine. And once we loosen that up, the hips loosen up better. So we can get these muscle imbalances to correct a good degree just by knowing where to begin working. So the order is important and the specific location is important of what we're doing. So that is how we approach things. It's a highly manual approach, a highly hands-on approach, and then if things still need to be done with regards to exercise, we give you those. And that is a good complement to what we do in the clinic. So let's talk really quickly about what kinds of conditions and syndromes we see in the hip that are related to these muscle imbalances. You can have pain in the back, you can have pain in the side, you can have pain in the front, or maybe even deep in the joint. Pain in the back is normally not an actual hip joint problem, that ball and socket joint. It's not. Pain back here is typically related to dysfunctions in the lower lumbar spine and sacroiliac joint. It could be the sciatic nerve, which is running through here. It could be the piriformis muscle, which is also right down there, that could be holding on very tightly. When we treat things down here, this pain usually resolves. The same is actually true for pain on the outside of the hip. Yes, it's true that there's that hip bone and there's the bursa and the tendons out there, but what we think of as bursitis, right? You've probably been diagnosed with bursitis in this area. 9 times out of 10, that's a problem coming from the low back, all right? It's not the hip itself. So that is a big misunderstanding, but anything out here, back here, it's usually a low back problem that needs to be corrected. The pain in the front is actually coming from the hip joint most of the time. All right, that ball and socket joint, when there's arthritis or a torn labrum or a problem in the joint that's just inflamed, you'll usually see that groin pain, maybe even pain going down the inside of the thigh or the front of the thigh. That is typically a hip issue, and we'll deal with that a little bit differently. But in all cases, we want to look at the mobility and the strength of all the joints in the area, really head to toe ideally, to understand the relationships and what could be causing what. We go after what is restricted, not where the pain is. Chasing pain is a mistake for any clinician, and that's really the approach. It's highly manual, highly hands-on, and we find what's wrong and we go after it and take the treatment from there.